Chers téléspectateurs, bonjour. Nous sommes ravis de vous avoir dans le cadre des productions de la télévision Le Réformateur. Aujourd'hui, nous avons la joie de vous présenter un ancien documentaire de l'œuvre de santé de l'Église évangélique luthérienne du Cameroun. Ce documentaire retrace un tout petit peu la vie à l'hôpital protestant de Ngaoundéré, à la clinique dentaire et au centre luthérien d'ophtalmologie. Ceci en perspective du centenaire de l'Église évangélique luthérienne du Cameroun qui se prépare 1923-2023. C'est l'histoire.
Mr. and Mrs. Andresen arrived in Cameroon around the 1930s. They were at the head of a group of Norwegian missionaries and came to evangelize the population of the north, but they settled in Ngaoundéré at Ndelbi. They soon realized that evangelization would be difficult if it wasn't associated to social issues. Mrs. Andresen, who was a nurse, started immediately a medical work. Due to the lack of buildings, she decided to go from one house to the other to visit and cure the sick. A few years later, the mission decided to grant her a few cabins for patients who needed medical treatment. As a result of the increasing number of patients, the mission decided to associate indigents and foreigners so as to facilitate the work. Bit by bit, Mrs. Andresen's cabin became a small training center which attracted the fellow feeling of the authorities of that era. From its creation till today, the spiritual part of their mission has been the pedestal of the Protestant Hospital of Ngaoundéré. Every morning, the working staff meets at the chapel for meditation. Work begins in the hospital with a briefing of doctors who later go in the various specialized units. The hospital has many specialized units. The most important are emergency, the intensive care unit, surgical ward, pediatric ward, maternity ward, and medical ward. There are also others such as the Welfare Center for outpatients, maternal and infantile health, for prenatal consultation and for the consultation of children. Surgical ward, the hospital focuses on anesthesia. The anesthetist's main function is to evaluate the anesthetic risk during surgical interventions. For its 60th anniversary, the Protestant Hospital of Ngaoundéré will welcome foreign visitors. We shall have many visitors in our hospital. The SMDC team, which is a great hospital in the United States of America, with which we have signed a partnership, according to which the SMDC hospital has promised to develop our hospital and make it the biggest medical training center in the northern part of the country. The Protestant Hospital of Ngaoundéré opens its doors to internal and external candidates. We also train many doctors in our hospital. Every year, we welcome a team of 2 students coming from the Faculty of Medicine for a period of 3 months. We also have students coming from the University of Montaigne. Last year, we trained many of them and others from Germany.
étudiants venant de certains pays comme l'Allemagne et les facultés de médecine d'Allemagne.
We also collaborate with a school in Norway at Stord Hagson, which sends us 5 nurses each year for training. The hospital is known to be a training center thanks to exchange and partnership programs. Apart from being a training center, the Protestant Hospital also offers great medical services like kinesthesia and has many apparatus like those used for endoscopy, mammography, and has a laboratory. In order to accompany patients who are in the terminal phase, a palliative center has been put in place so as to take care of patients suffering from cancer, HIV/AIDS, and other chronic diseases associated with pain.
From America, from the University of Minnesota. I'm here helping out with the medicine and pediatric wards, as well as helping start out a program for palliative care. It's been great since I've been here. I feel very welcome to be here. The staff has been fantastic, helping integrate me into the system, It's very important to get a holistic view of the patient, to take care of their needs, their social needs, their spiritual needs, and their medical needs.
The Palliative Center collaborates with the Social Assistance Service and the chaplaincy of the hospital. Every day, we give psychosocial help to patients and to their guardians. Some people also come for help at the levels of families and services, and we help them to solve their problems.
I talk to the pastor with my situation. I don't have nobody to help me, and I don't know anybody here, so I need their help to rescue me. They decided to hospitalize me.
The Protestant Hospital uses the new information and communication technologies, and the maintenance of medical equipment is a prerequisite. The information of all the services is done by intranet. The SMDC team has come with a new software for the management of patients, of the accountancy, of medicines and statistics.
The motivations, I think, for this project were basically to try and help the hospital do a better job of keeping track of the costs for things and what money comes in from the patients. And I think that these computerized systems will help a lot. It'll be a good start to have that on electronic format.
Well, I'm helping with DOTA mainly to set up computers and screen for viruses with antivirus programs, and basically get them ready to connect into a network.
The hospital has a qualified clinic for dentary problems and just beside the dentary clinic is the ophthalmology center of Gaundere. It is the only ophthalmology center in the province. Considering the chessboard, I think we have a place in the sun because we give great statistics in the fight against blindness. We offer them our social site, our staff, and of course, different technologies. The Protestant Hospital, in collaboration with its SMDC partners, have decided to construct new buildings for urology, cardiology, and the extension of the PACS project.
When I retired in 1996, I decided I wanted to do some volunteer work in a developing country, and I approached the EELCA, the Evangelical Lutheran Church of America, and became a volunteer for their global missions, and they sent me to Cameroon. And after having been here, I saw the enormous need, and my husband and I approached SMDC to develop this project.
The motivation for the SMDC to be involved in Cameroon is born out of the fact that SMDC is the Catholic Benedictine health system, and their mission statement is education and take care of the sick people.
The project was initially funded for 3 years, and then it has been funded several times for 3 years, and we are now in our 9th year. But the SMDC has decided that this is a project they want to continue indefinitely. And the object right now is to develop a new hospital instead of the pavilions from 1940, and to support OSELC in becoming an educational institution and a referral hospital for the region.
The first sanitary training centers were created about 60 years ago by the missionaries. It is true that the church followed the steps. After 60 years, we think that it's time to take another step, that is, the modernization of sanitary training, and it requires a lot of work and finances. That is why we rely on the Ministry of Public Health and on our partners. We are developing several conventions with our partners, and we hope that in a few years to come, we shall